Did you know that in 2025, something as simple as feeding a bird or carrying too much cash could label Australian seniors as criminals? Sounds unbelievable, right? But these aren't dystopian predictions, they're real rules rolling out across Australia right now. Government reforms meant to modernize society are quietly shifting the legal landscape, and older Australians are the ones paying the price. From strict new ID laws to surveillance apps and AI health reports deciding if you're fit to drive, the everyday lives of seniors are being reshaped, and not for the better. Is this protection or control? And what happens if you unknowingly break one of these rules? The consequences are real, and in some cases, devastating. Stick with me, because we're breaking down the 10 shocking new laws that could turn innocent elders into lawbreakers overnight. And you won't believe number 7.
Number 10. Seniors flagged for sharing misinformation online. In 2025, sharing an old Facebook post or forwarding a health article could do more than just spread confusion. It could label you as a digital offender. Under Australia's new Online Integrity and Safety Act, individuals who share what the government deems misinformation can now be flagged, suspended from platforms, or even referred for legal action. And guess who's getting caught in the crossfire? Seniors. Many older Australians use social media to stay connected with family and friends, but they're also the most likely to unintentionally share outdated or misleading information, especially on health, finance, or government policies. These posts don't have to be malicious to be flagged. All it takes is one automated scan, and suddenly your account is under review. Innocent posts like "cure arthritis naturally" or resharing a meme about Medicare cuts could trigger penalties under these new digital laws. If repeated, the user might be locked out of their account, reported to regulatory bodies, or even receive a formal warning for contributing to public misinformation. The system relies heavily on AI content monitoring, which means no human checks the context. If the algorithm decides your post is harmful, you're guilty until proven otherwise. Critics argue this approach is too harsh and confusing for older generations, many of whom aren't aware of how quickly online information can become false or outdated. Others say it's a necessary step in fighting fake news. To avoid trouble, seniors are now being encouraged to fact-check all posts before sharing, stick to official government and health websites, and avoid resharing viral content unless it's from a trusted source. Because in 2025, a single click could turn a retiree into a rule breaker with their reputation on the line. So there you have it, 10 new Australian rules that sound more like sci-fi than reality. Yet they're rolling out across the country in 2025. Rules that target ordinary actions, disproportionately affect seniors, and blur the line between protection and punishment. From using cash to feeding birds, sharing health tips to caring for a loved one, suddenly these simple acts carry legal weight. What's most alarming? Many of these changes aren't widely publicized. Most seniors don't know they're coming until it's too late. No one expects to become a criminal for following lifelong habits, but that's exactly what these rules make possible. This isn't about resisting change or fearing technology. It's about fairness, inclusion, and making sure our elderly population isn't left behind or penalized in the name of progress. Seniors deserve support, not surveillance, clarity, not confusion. So what can you do? Talk to your loved ones. Help them get informed. Stay updated with local council laws and national reforms. Encourage respectful dialogue, not panic. And most importantly, don't stay silent. Share this video with someone who needs to see it. Hit that like button to support awareness, subscribe to our channel for ongoing updates, and drop a comment below. Which of these rules shocked you the most? Do you think they're necessary, or have they gone too far? The rules are changing fast, but together we can keep each other informed, protected, and prepared.
Number 9.
Feeding birds in public now fined as environmental harm. It might sound harmless, even sweet. An elderly woman tossing breadcrumbs to ducks at the park. A grandpa sprinkling seeds near a bench. But in 2025, feeding birds in public spaces is officially classified as an environmental violation, and it can now result in instant fines of up to $350. Yes, you read that right. Under new urban wildlife protection laws, local councils across Australia are cracking down on what they call unsanctioned feeding behavior. The reasoning? Leftover food attracts pests, disrupts ecosystems, and encourages unnatural wildlife behavior. While these goals may sound noble, enforcement has been anything but gentle, particularly toward seniors. Many older Australians enjoy feeding birds as a peaceful daily ritual. It's a social activity, a connection to nature, and for some, a mental health anchor. But now, what used to be a calming routine is suddenly considered biological interference. Some councils have even installed CCTV cameras in parks to monitor and identify repeat offenders. In some cases, rangers are empowered to issue fines on the spot without a formal warning, even if the person didn't see the sign or didn't know the rule had changed. Imagine being fined hundreds of dollars for doing the exact same thing you've done for 20 years without ever being told it was wrong. Critics argue this is less about environmental safety and more about over-regulation targeting those least able to defend themselves. Seniors with poor vision may not see the no feeding signs, and many are unaware of these new rules altogether. To stay safe, always check for park signage, and in doubt, don't feed. It's heartbreaking, but in 2025, kindness to animals could cost you more than you think. Number 8. Anonymous elder abuse reporting triggers surprise police visits. In 2025, protecting the elderly has become a national priority, but not without serious consequences for the very people it's meant to protect. A new law allows anonymous reports of elder abuse to immediately trigger government investigations and even unannounced police welfare checks. While this sounds good in theory, the system is ripe for misuse, and many innocent seniors are already paying the price. Under this policy, anyone, a neighbor, caregiver, even a disgruntled relative, can file a complaint without providing proof. Once lodged, authorities are required to act within 48 hours, often arriving at a senior's home without notice. For many, it's a terrifying experience. Uniformed officers at the door, asking invasive questions, searching for signs of neglect or mistreatment, even when nothing is wrong. What's worse, a single false report can lead to ongoing monitoring, reduced autonomy, or mandatory involvement of aged care agencies, regardless of the senior's wishes. Some older Australians are now afraid to speak openly, fearing their independence might be taken away based on a misunderstanding or personal grudge. Imagine living alone, minding your own business, and suddenly being treated like a suspect in your own home, all because someone thought you looked unwell or sounded confused on the phone. While the intention behind the law is noble, critics argue that it's creating a climate of fear and overreach, especially among those who are perfectly capable of managing their lives. To stay safe, seniors and families should keep health documents, care plans, and legal permissions updated and accessible. Transparency is now a shield against suspicion. Because in 2025, a well-meaning law could turn your quiet retirement into a courtroom drama without you ever seeing it coming.
Number 7. Superannuation mistakes now treated as financial crimes. Managing your own retirement funds used to be a sign of independence. But in 2025, even the smallest mistake in your self-managed superannuation fund, SMSF, could be treated as a criminal offense. Under tighter financial regulations designed to protect retirement wealth, the government is rolling out new oversight measures that will automatically audit SMSF accounts using AI-powered compliance software. And if your records don't match, even due to a simple error, you could face serious penalties. Seniors who manage their own funds are now being held to the same standards as financial professionals. One misplaced decimal point, one missed report submission, or one delayed contribution could trigger a compliance breach, leading to fines, freezing of funds, or fraud investigations. Yes, even if it was an honest mistake. Imagine logging into your account and finding it locked because you didn't submit a minor form on time. Now you're suddenly unable to access your savings, all because of new bureaucratic traps few seniors are even aware of. The most vulnerable are retirees who handle their super without expert help. Many don't fully understand the growing list of new compliance requirements or how often the rules now change. The government argues that these measures will reduce scams and shady operators, but critics say they criminalize ordinary people trying to manage their money without expensive advisors. To protect yourself, experts now strongly recommend switching to a regulated, professionally managed super fund, or at the very least, hiring a certified accountant to regularly check your paperwork. Because in 2025, your retirement fund isn't just your nest egg anymore. It's a potential legal liability.
Number 6. AI-driven driving restrictions could strip seniors of licenses. In 2025, it's not a doctor or a driving assessor who might decide if you're fit to drive. It's an algorithm. Under Australia's new road safety reform, seniors over the age of 70 will be subject to AI-powered health data assessments that automatically flag individuals deemed at risk for driving. The twist? You might never even know you've been assessed until a letter arrives suspending your license. Here's how it works. Health data from your Medicare records, pharmacy scripts, wearable devices, and even government wellness apps will be fed into a central system. If the AI detects patterns of potential decline, like early signs of dementia, poor sleep, balance issues, or missed medications, it can recommend that your license be restricted or revoked without a human ever speaking to you first. Sounds efficient, but for many seniors, it feels cold, invasive, and dangerously inaccurate. Imagine being in perfect control of your vehicle only to be told a machine decided otherwise. There's no appeal unless you navigate a complex medical reassessment process, which could take weeks, during which you're not legally allowed to drive. For seniors in rural or suburban areas with little public transport, that could mean complete isolation. Even worse, the system doesn't consider context. Skipped one medication because of side effects? That might be enough to trigger a flag. Had a mild health condition years ago? Still fair game. Critics argue this is a clear case of technology overreach, punishing independence and mobility in the name of safety. Supporters say it will reduce road deaths. But at what cost? If you or a loved one relies on driving, speak to your GP now, ensure your health records are up to date, and request manual oversight when possible. Because in 2025, losing your freedom might come from a line of code, not a road test.
Number 5. Mandatory health app check-ins or face monthly fines. In 2025, staying healthy might not be enough. You'll need to prove it to the government every single day. A new National Health Compliance Initiative will require all Australians, especially those over 65, to use a government-approved health app that monitors daily check-ins, medication reminders, and wellness prompts. The goal? To streamline public health data. The downside? Non-compliance could cost you, literally. If a senior fails to check in using the app for a certain number of days, automatic monthly fines will be issued. For some, these could start at $75 and escalate over time. And if you miss multiple alerts, like confirming you've taken your meds or logged your physical activity, you might be flagged as non-responsive, triggering welfare checks or even temporary suspension of certain benefits. The problem? Not all seniors have smartphones. Many live in rural areas with poor internet access or simply don't feel comfortable using apps to track their personal health data. But the new law doesn't care about digital literacy. It expects compliance, period. Even something as innocent as forgetting to charge your phone could be interpreted as refusal to comply. And while the system promises to offer exceptions, the process to apply for exemption is buried in red tape, requiring documents, forms, and online portals most elderly citizens won't easily navigate. Imagine your 82-year-old father, who's never owned a mobile phone, suddenly being fined for not tapping yes on a screen he doesn't even own. To avoid penalties, families should help their elderly loved ones download and register the app early, and set up automatic check-in alerts or delegate a trusted carer to assist. Because in 2025, your health isn't just private anymore. It's a digital responsibility. Miss a beep, and you could be paying the price.
Number 4. Retirement housing underutilization evictions. Imagine living in the same home for 30 years, only to be told that it's now too big for you, and you have to leave. Sounds unreal, right? But in 2025, new housing efficiency reforms will allow government agencies and housing commissions to evict seniors from public or subsidized housing if it's deemed to be underutilized. In simple terms, if you're living alone in a 2- or 3-bedroom property, you may be considered an inefficient use of housing stock. The aim, according to officials, is to address housing shortages by reallocating excess space to families in need. But for many elderly Australians, this feels less like policy and more like punishment. Seniors who have spent decades building memories in their homes now face forced relocations to smaller units or shared facilities. The catch? Many of these units are located far from their current communities, doctors, or support networks. Even worse, failure to respond to housing department notices could be treated as non-cooperation, leading to eviction proceedings without appeal. One late letter, one missed form, and you could be on the move. This policy doesn't just affect government housing residents. Some private retirement villages and aged care complexes are also adopting similar space efficiency rules, pressuring seniors to downsize or move out if their living situation isn't considered optimal. Critics call it a quiet displacement, targeting the elderly in the name of progress. And while the government offers relocation support, many say it's nowhere near enough to cover the emotional and financial toll. To stay protected, seniors should review their housing agreements, speak to a tenancy advocate, and be proactive in responding to notices. Because in 2025, being a single occupant might be reason enough to lose your home, even if it's the only place you've ever truly belonged. Number 3. AI compliance in home care could penalize family carers. In 2025, caring for your aging parent or spouse at home could come with legal risks you never imagined. Under new national home care regulations, all aged care providers, including informal family carers, must comply with AI-driven monitoring and reporting standards. That's right. If you're helping a loved one at home, you could now be treated as a regulated care provider, and failure to follow the rules could result in fines or even withdrawal of government support. The new system uses artificial intelligence to track and assess care patterns, flagging anything that seems inconsistent, incomplete, or non-compliant. While designed to prevent elder abuse and neglect, critics say the system is alarmingly unforgiving, especially toward well-meaning families just trying their best. For example, if you forget to log meals, miss a medication update, or don't respond to a government app's daily check-in prompt, AI may tag your care as substandard. Once flagged, the system could automatically suspend support payments, investigate your household, or require formal reassessment by a third-party agency. This is especially troubling for elderly couples caring for each other, often without digital skills or professional training. Imagine a devoted husband of 50 years looking after his wife with dementia, now being told he must submit digital care records through an app just to keep her home help. The government says this AI integration will improve transparency, but families argue it adds stress, confusion, and the constant fear of messing up. The harsh reality? If you don't tick every box, you're out. To prepare, families are urged to speak with registered aged care providers or social workers and learn what systems will be required in 2025. Because soon, love and good intentions won't be enough. Compliance will be king.
Number 2. Cash payments over $500 could trigger investigation. For decades, many Australian seniors have preferred using cash. It feels safe, familiar, and keeps them in control. But in 2025, that simple act of pulling out a $50 note could come with serious consequences. Under new federal financial regulations, any cash payment over $500 will be automatically flagged and reported to government authorities as a potential risk transaction. That means paying cash for a handyman, a second-hand appliance, or even a bulk grocery run could be enough to land your name in a financial watch list. While the government says it's aimed at reducing money laundering and tax evasion, critics warn this disproportionately targets everyday Australians, especially seniors, who rely on cash to manage tight budgets or avoid online scams. Here's the kicker. Even if you're doing nothing wrong, the system doesn't ask questions, it just reports. Seniors who don't use digital banking or prefer privacy could find themselves under investigation simply for using money the way they always have. And worse, those who repeat these kinds of transactions may be labeled as suspicious actors, facing audits, account freezes, or in some cases, visits from compliance officers. Imagine a retired couple paying $600 cash to a local cleaner or gardener, something they've done for years, now suddenly seen as a red flag. They're not criminals, they're not hiding anything, but the law doesn't care about intent, just numbers. To stay safe, experts suggest limiting any cash payments to under $500 and switching to debit cards or traceable payments where possible. But let's be honest, not every senior trusts apps or wants their every move tracked. Is this financial safety or silent control? As 2025 approaches, one thing is clear. Your wallet isn't just a wallet anymore. It's a liability.
Number 1. Digital ID required for Medicare or no service. Imagine walking into your local medical clinic only to be told you can't see your doctor, not because of your health, but because you're holding the wrong ID. Starting in 2025, Australia will phase out physical Medicare cards in favor of a fully digital identity system, requiring seniors to use a government-approved digital ID to access essential health care. While it sounds like a step forward in technology, the real-world impact on older Australians could be devastating. Many seniors aren't tech-savvy. They don't own smartphones, or they struggle to navigate apps and online portals. Yet, under the new law, anyone who fails to present a valid digital identity linked through apps like MyGovID could be denied medical services, or worse, flagged for using invalid documents. In extreme cases, it may even be treated as an attempted fraud, especially if the individual tries to use an expired card unknowingly. This rule doesn't just impact hospitals. Pharmacies, aged care centers, and even bulk billing GPs will be required to verify patients digitally. That means elderly Australians could be left without prescriptions, care plans, or even emergency treatment, all because they didn't scan the right QR code. The government claims this move will reduce identity theft and fraud, but critics argue it will exclude thousands of vulnerable seniors who either can't or won't adapt.
Some families are already rushing to set up digital IDs for their parents and grandparents just to make sure they can get help when they need it most. So, what can you do? If you or your loved ones haven't yet set up a digital ID, do it now, with help if needed, because come January 2025, being offline may not just be inconvenient, it could be dangerous.